Grab a Mackay HLS set box that contains the Cardiohelp disposable circuit, one manifold bridge, and one large bore pigtail. To remove the circuit from the box, undo the Velcro that anchors the oxygenator. Remove the oxygenator and plastic sterile table tray and set aside on a table. Remove sterile priming bag and hang on an IV pole attached to cart. Remove additional clamps and scissors if needed to make extra room. Keep green oxygen tubing. Trash emergency prime line. Keep yellow cap. Trash small pigtails. Trash pointless caps you can't see. Keep 3/8 lure lock connector. Keep 2 3/8 straight connectors. Keep zip ties. Trash ridiculously cheap blue plastic clamps that are included in a tubing pack that costs almost $12,000. Keep 50 ml syringe. Keep scissors for the circuit build. Immediately discard in sharps container after use. We'll need at least one Medtronic quick prime line and 1/4 inch perfusion swivel adapter. To close safety bar, you only have to press a single red button on the side. To open, you will see both buttons are red. To insert the motor and oxygenator, tilt slightly to the right, insert, and tilt to the left to click into place. Lower safety bar and attach sterile table tray to the top. Make sure you twist the tray around to prevent from French braiding and tangling the tubing. Attach flow/bubble sensor between the two white lines on the red arterial tubing. Ensure that the arrow is facing the correct path of blood flow. Remove sterile connector stubs and match red to red and blue to blue. Be careful to not contaminate the sterile area by touching the tip of the connectors with your disgusting, grubby paws. All circuits must be assembled using aseptic technique. Connect the pressure sensor probe. Remove plastic cap and attach one large bore pigtail. Attach yellow cap. Remove the manifold and attach to the holder. Wipe off the blue venous tubing with alcohol and cut with sterile scissors. Once again, use proper aseptic technique and do not contaminate sterility with your dirty, Staphylococcus having feces infested, haven't washed your hands all day, grubby paws. Grab the 3/8 lure lock connector. Use an alcohol swab to clean and lubricate the connector and tubing. Attach the connector by connecting at a slight angle to spread the tubing out, then using a forceful circular motion to manipulate the tubing down the connector. Use the connector packaging or an alcohol swab to ensure sterility on the opposite end of the connector. To avoid contamination from your grubby paws, ensure that you get the tubing past the second barb so we can add zip ties later. Rinse and repeat. Attach the blue manifold tubing to the lure lock connector. Attach the red manifold tubing with the one-way valve to the connector at the top of the back of the Quadrox oxygenator. Remove white caps from manifold and replace with microclaves and green caps using sterile technique. Attach oxygen tubing to the tank and filter. Zip tie the manifold connector by tightly connecting to the middle barb of the connector. Use zip tie gun to tighten and cut off the excess. Lightly press the trigger a few times to tighten the zip tie to the connector, then firmly pull the trigger all the way to cut.